The main challenges now is about this small subset of patients with oncogene addiction, EGFR and ALK. So the challenge is to know, today we have second-line treatment for this patient, which are second or third generation TKI. So you start with the old generation, you go to the modern generation in second line. And many trials are now trying to see if the new generation shouldn't be given first. And the main challenge in second line is that the second line might come front line. And the question in the community is what would be our criteria to accept this move? And then if we do so, what's going to be the subsequent second line to replace? And this question of what is our minimal requirements to imagine that, like breast cancer colleagues wonder since a while, then the best first is better than sequencing. It's really a question that we have in the community. So the challenge is more to define how to sequence the drugs. We have the data of frontline Alectinib in a global study, which is called the ALEX study, which compares frontline Alectinib versus frontline Crizotinib. The endpoint is PFS. There's a press release telling that it's a positive trial. But this trial also evaluates how you can prevent, for example, the emergence of new brain mets. So that's very important for the patient. So all these parameters will help us decide if it should be Crizotinib followed by Alectinib or Alectinib frontline. So it presented at ASCO. The same trial, osimertinib for EGFR, osimertinib versus erlotinib or gefitinib frontline, will probably be presented by the end of the year too. So we'll have a better definition of it by the end of this year.